Hello and welcome to Health Pacific. Happy Valentine's Day, first of all, to all of you. And because it's Valentine's Day, I would like to take this opportunity to explore love from the perspective of health. When we say love or when we talk about Valentine's Day, we often mistake it only for romantic love. But someone very beautifully reminded me today that Valentine's is someone who is constantly with you through the thick and thin, through every situation possible, who accompanies you throughout, is your Valentine. And isn't one constant person who is always with you, no matter what. You yourself. So you owe it to yourself to take care of you because you are constantly with you. That's just a food for thought. Now let's dive into the health aspect of love. How love is important or is significant or helpful, or how love contributes through every stage of life: the childhood, the middle age, and the old age. And this is all backed by research. Let me put that first. So when we say love, they say that don't call love a noun. Love is a verb. It is the action that that is taken in regard to prove how much or what kind of love you have. So be it for the other person, be it for yourself. If you're taking care of yourself, you are loving yourself, right? They say self-care is self-love. So it's not just one aspect of love. You can call love care. You can also uh, put love in the form of kindness. So love is anything that is not, or that is opposite of all the negative emotions that you have, right? So being kind is love, being concerned is love, being empathetic is a form of love, isn't it? When we speak about love or these good feelings, the feel good part of emotions, or the soothing, the calming part of the emotions, it is already scientifically backed by research that your body secrets the hormones that are aligned with that emotion. For example, a mother feels that rush of oxytocin when she holds or looks at her child. And it is scientifically proven, that the hormones are secreted in her body. And yes, these good hormones help her in healing, not just her, but her baby as well. If you just randomly take a look at a kid, you naturally secrete serotonin. So that is another hormone that we can say is generated when there's a feeling of love or um, happiness. So there are other happiness hormones as well, the dopamine hit, the endorphins. But then these are all the positive or good hormones that are secreted when you feel the act of kindness, when you look at the act of empathy, when you look at the act of sacrifice in the name of love. These good hormones generate in your body, and they in turn help you in healing, in giving a positive boost to your mind, to your brain. So when we speak about love or these positive emotions in the childhood, of course it is going to help in a better parenting journey of you as parents, or better receiving and like your kids, when it comes to their growth phase, their growing age. So if that stage of childhood is accompanied by or supported by or supplemented by a proper amount of healthy love, care, concern, it is definitely going to cherish, right? So in the middle age, in the youth, it's all about building relationships, the relationships with your spouse, say better half, the relationships with your kids, again, to make them stronger, the relationships with your friends and family, the extended family. So the youth is all about, building careers, of course. Now that is another part of it, but building personal relations. And when I say relationships, I mean the deeper bonds that you have with people, the meaningful, the valuable relationships, the friendships that are not superficial, but that are non-judgmental. One can pour their heart out, they can express what they feel without the fear of judgment. That kind of relationships, and I'll tell you why that's important going ahead. So these kind of meaningful bonds are created in the middle age, and they are important for your health as well. These days, why do people need so much therapy outside is because they don't have people to talk to. So they say that if you have nothing to give to anyone, at least give your ears, give your time, give your undivided attention to just hear them out. And that is so difficult to find these days, with all that you want to show on social media. I took this, I'm that successful, I do so many great things. You just want to show off on social media and get validation from the people who are superficially connected to you, because just because they're on your friend list. And that is what I'm talking about. There can be crowd, but in that whole crowd, how many valuable, meaningful bonds do you have, who will take you as you are, in your original form, in your natural form, without you wearing a mask of how beautiful you look, what kind of things you own or possess. That kind of meaningful bonds, and they are so much important for your health. Let me tell you, so much important for your health. So, not just the crowd, not just the superficial socializing, but the deeper, meaningful connections is what I'm talking about. And why is it important? Because the part of love and the kindness that is expected in the old age, uh, there's a study already which proves that people who live longer uh, are those with the meaningful connections. And loneliness is set to increase the rate of mortality and uh, prove harmful for better prognosis if there's any diagnosis in the geriatric age group. So in old people, if they are isolated, if they are lonely, they tend to recover slowly or not recover at all. And when there was a survey done in the areas where, like they say, they call it blue zones, where people live longer, there they find that there are meaningful relationships, there's a healthy socialization between people, and there is less isolation among them. They are less lonelier. And there's another research that also proves that loneliness is detrimental when it comes to health. So that is the kind of impact this makes on your health. So, like I said, when I say love, it is not just the romantic side of love, it is the act of inclusion, it's the act of building deeper, meaningful relationships, it's the act of kindness towards, and it's the choice ultimately. You have a choice to hate or love, you have a choice to be greedy or feel love. You have a choice to be empathetic or you have a choice to be judgmental. And yes, ultimately, it all comes down to choice. And if you choose to love, my dear friends, you are not going to be disappointed in the long run, because This choice to choose love every time, to choose kindness every time, to choose positivity every time, to look at the positive side of things every time, in the long run, it does help you, and you don't even know what kind of changes it is making in you, the kind of good things that you're attracting. So, in the age where vulgarity is easily sold out, where there is more audience for the negative stuff on social media, I think it's your choice to choose what's best for you. And this is a form of self love. When you choose kindness, when you choose love, when you choose happiness, when you choose positivity, you in turn choose health. You in turn attract health. I think that is all I wanted to talk about today. And it's just a heart to heart communication that I've carried out. I hope it helps. And I'll see you again soon with something, of course, relating to health. Bye bye.